Hey everyone, Dr. Tam and Candy here today, and we've got a really exciting topic for you. For all the moms out there, pregnant moms, moms to be, wanting to get pregnant, maybe you're on the second one. We've got a really good topic for you. Now, for those of you who have heard of us before, who've been on the show, thank you for coming back and hitting the subscribe button. For those of you who are first times, you want to make sure that you catch all the different episodes and make sure you hit that subscribe button as well. So Candy, let's get started. Where do we go from here?
Thank you, Dr. Tam, and hello to our viewers. So, for our topic for today, it's very interesting because we have lots of questions for this one. So, why pregnant women should choose structural or chiropractic?
Yeah, I mean, that's a great topic. I've taken care of so many pregnant mommies throughout the years, and we currently have pregnant mommies in the office. We have babies that are newborn, under a year old. For a lot of our patients, you'll always see a baby walking around or, crawling around in the office. And we have these big old pillows specifically for our pregnant moms that they really love using it. So let's go through some of the top things why moms need to get chiropractic care. Now, number one, for those of you who've ever been pregnant, you will experience some form of lower back pain. That's just given most of the time. The reason being is because you're carrying an extra 20 to 40 pounds in front of you, right? For those of you guys and moms to be who haven't felt it yet, imagine if you strap a big backpack in front of you and you put a 30-pound watermelon in there,
Wow.
right? I mean, Candy, and then you're walking around with that, Candy,
Mm-hmm.
for 9 months. How do you think you'll feel?
It's very heavy. I'll have my back pain.
Yeah, it's very heavy. When you're carrying that 30-pound watermelon around for 9 months, it's going to have a lot of wear and tear on your back. There's no doubt. I always tell moms this. The hardest time during pregnancy is you have to prepare the 1 year before and 2 years after. 1 year before the pregnancy, during all the times where you're carrying the baby, it's hard because it's hard on your back. Nearly 3 million moms every year suffers from some form of back pain. It is one of the most biggest reason why people visit the emergency room for musculoskeletal
Mhm.
pain. And if the back pain is left untreated, it can easily start going down the legs, turn into something even more serious, like sciatica or radiating back problems.
Now, for the next question, what would be the healthier preparation for pregnancy and labor?
Well, for a lot of moms, it's making sure that you're eating good, right? I always
Mm-hmm.
tell moms, I say, are you taking the right supplements? Are you eating the right foods? Are you getting enough exercise? Certain
Mm-hmm.
cultures will tell moms to lay down and not do anything. That's like the worst thing you can do. You have to have exercise, maybe walk some stairs, do daily walking still, maybe not as intense as before if you're experiencing pain, but at least for the first few months, right? You need that exercise almost the same as before, toned down a little bit. And then as the time goes by, second and third trimester, you still need to have exercise as well. Just because you're pregnant. See, I don't want people to think pregnancy. Sometimes we think in the US, pregnancy as a handicap. It's almost as if, oh, you're pregnant. Sit down. Don't do anything. No, get up and do something. There's still things that you could do, right? And that you want to be active. Do you want to go snowboarding and, have a chance of falling all over the place when you're pregnant? No. Do you want to go jet skiing and have, your body bob up and down on rough waters? No. But can you go for a nice walk, a hike, right? Still play with your other kids, be active? Absolutely. Should you be laying in bed and doing nothing? Absolutely not. Don't treat, and your family members. Those who have family members or friends who are pregnant, you shouldn't treat them as if they're handicapped, like they have a disability or something. You
Yes.
know, it's something that it's part of life, and life continues to go on. See, what moms need to understand is if you become very sedentary during your pregnancy, that will increase your chance of other medical interventions like an epidural or increase your chance of C-sections because your pelvis and your muscles in your body is not even strong enough for labor because you've been laying around for a long time, right? Of course, there are certain situations where doctors will put moms on bed rest, but ultimately it's better to stay more active.
Now, since Doc, you mentioned about pelvis, does it help like stabilizing and aligning the pelvis as well?
Well, when you are looking at chiropractic and the
Mhm.
adjustments that we do for moms, absolutely. The whole goal is to stabilize and align the pelvis and the muscles in the localized areas on top of some muscle work. But being active also helps mobility in the pelvis, right? Sitting down, especially in the slouching position, is one of the worst things that you can do for your pelvis because your sacrum, which is the tailbone, doesn't actually get to move at all. And that actually stops, right, pregnancy and the labor from actually happening, from the pelvis actually widening and opening. So you do want to exercise, you do want to get adjusted because absolutely it does help stabilize the pelvis.
Now, Dr. Tam, you also mentioned earlier that it helps also prevent sciatica. Can we
Yeah.
talk or can you let us know more about it?
Well, sciatica is one of those it's a pinch nerve problem, right? Somewhere along that nerve is being pinched. It's affected that nerve, whether it's at the piriformis muscle, which the piriformis, the reason why the piriformis is lit up on fire and pinching the sciatic nerve is due to a misaligned pelvis. Or that problem is coming from the lower back, where the nerve is being pinched from the lower back. And when you talk to moms, the ones who've had back pain or who have severe back pain, that pain is shooting down the leg, right? And that's what sciatica is, radiating pain going down the sciatic nerve. And absolutely, chiropractic adjustments, staying active will help with that.
Can this also help prepare for best intrauterine environment for the baby?
Well, you look at the baby, what's the
Hmm.
best environment for the baby to live in, right? This baby is living in this cramped space, right, for 9 months.
Yes.
And the more movable you are and freely moving, and the wider your pelvis has the ability to open and close while during pregnancy, the better environment you're going to have for the baby, right? Less chance of other problems happening.
Hmm.
There's more room for the baby to move, right? More room for the umbilical cord, the uterus, the ultimately the placenta to form as well, because constriction is not a good thing, right? Even though the baby's already in a very constricted space, you want to have that mobility. Absolutely.
Now, also, Dr. Tam, one of the most common reason why mothers like seek chiropractic care is because of the baby is in breech position. Can you tell
Yes.
us more something about it?
So the breech position is
Hmm.
when the baby is a lot of times maybe their head is down, right? There's certain breeches. The head is down, but their face is facing the back of the pelvis instead of facing the forward.
Hmm.
Sometimes their butt is down, right? The reason why a lot of babies are breached is because that misalignment in the pelvis. We actually have midwives and other specialists that send moms to our office,
Hmm.
and somehow the word has gone out that we help babies get unbreached. Now, that is partially correct, but not 100%. It's not that we
Okay.
turn babies or anything like that. It's actually a lot of studies show that it's unsafe to force
Hmm.
turn a baby, because what if the baby
Hmm.
has an umbilical cord wrap around their neck and you force turn it,
Oh.
right? It could be very traumatic for the baby. But what we do is create the environment to allow the pelvis to move correctly and the baby turns,
Mm-hmm.
ultimately. We can't control it. Like we have a mom that was 37 weeks old. She went in and checked and her baby's breached. And she freaked out like, oh my God, all of a sudden my baby's breached. Dr. Cam, I don't know what to do. I said, hang on. Instead of being completely stressed out about a breech baby, it's just that at the moment, your baby was turned to the breech position. See, it
Mm-hmm.
just happens to turn in that position. As long as your pelvis is moving the right way, nature is going to take its course, your baby's going to face the same way. And then what happened the following week? Her baby's like in the perfect down position for labor. And she came in, she says, oh, I'm so happy. I said, sometimes, ultrasounds are great
Mm-hmm.
because you get to see what's going on. But in the human history, for thousands and thousands of years, we never had ultrasound, right?
Correct.
And people had babies okay. It wasn't like the end of the world without ultrasound, but all of a sudden, some studies actually show that ultrasound's bad for babies. Okay, because of the sound waves that it's emitting. Because it has to bounce off the sound waves and bounce back to the machine in order for you to see the ultrasound. And some studies show that, ultrasound's not the best for babies, right?
Mm-hmm.
So
I
it
agree.
is one of those things where you have to see, okay, is it good? Should I do it? Should I not? People ask me all the time. It's good for diagnostic reasons, but
Mm-hmm.
not good. I don't recommend it if you're just saying, "Ooh, I want to see what the baby looks like." There's no diagnostic reasoning behind the ultrasound. So that's
Yes.
what I would recommend.
Now, Dr. Tam, can chiropractic care can also help the baby develop like optimal well-being?
Oh, absolutely. I mean, if you think about if a baby, here's the thing. The mom creates an environment for the baby to develop, right?
Mm-hmm.
So if the baby is developed in a really phenomenal, well taken care of home while inside the womb, the baby's going to come out more calm, less fight or flight, better hormones, better environment. During the delivery, it's going to be a better delivery, right? Pregnancy is going to be great. Mom has less stress. The stress levels from a mom actually gets transferred to the baby. So stressed out mom usually means stressed out babies, right? Just like if a mom did drugs when she was pregnant, the baby comes out kind of addicted to drugs already. See, so these things absolutely has an effect on the baby's development and well-being, right? Like the moms that we take care of have phenomenal pregnancies. Some of the moms that had terrible pregnancies the first time, they start getting worked on in our office, and the second one's like a breeze. Like, wow. And I said, well, don't brag to other moms about what's happening, right? Tell them about it. But that's ultimately what happens is I will like to create an environment where moms and babies have phenomenal pregnancy so that moms are not viewing their pregnancy and other people are not viewing the mom's pregnancy as a disability, right? So no one's just trying to hand you a wheelchair every time you go somewhere. So that's ultimately what, I mean, the body is really amazing. It's where we have ladies, I shouldn't say we, because I don't, but you guys have the ability to grow another human being inside of you. And it's a phenomenal event. But at the same time, you also have to take great care of you to make sure you provide the best environment for your baby. See? So another tip for moms who are trying to have a baby is, you should stop drinking right away and stop smoking right away if you're doing those things. Because the first 8 to 12 weeks, first 8 weeks especially, when the moms don't even know they're pregnant yet, that's one of the most crucial times for a baby's brain development. I actually tell moms to clean up your body for at least 3 months before getting pregnant. Because moms who have a very toxic body, if your body's toxic, you will unload a lot of the toxins into the baby. during your first pregnancy. So I tell moms, I said, at least 3 months, please eat really clean, right? Prep your body to carry a baby. See, 6 months is even better, but at least 3. Yeah, I hope a lot of moms out there, or moms to be, and families of moms get to learn a lot more about why it's important to really take care of your body, why get adjusted during pregnancy, and ultimately have a phenomenal pregnancy and make it a great experience. Thank you, everyone. Thank you, Candy. All right, bye now.